Welcome, everyone, to Office Hours. I'm your host, Stuart Newsom, and our session today is titled What AI and Revenue Cycle Management Will Actually Deliver in 2026. And I know we're a good 30 plus days into 2026. This topic is so relevant as AI has been a part of our lives for the last several years. Some of it's been hype, some of it's been very good, some of it's been very bad. So I'm joined today by Jaideep Tandon, who's the CEO here in Infinix. Jaideep is really in the middle of all these conversations that we have every day with healthcare leaders, whether it's our clients, whether it's prospects, whether it's other professionals in the industry. So his perspective really comes from seeing how AI actually plays out in real workflows. So JD, it's really good to see you.
Thank
Before
you.
we dive into the questions, though, I want to kind of set the stage, or have you set the stage. How are you seeing AI actually show up in those day-to-day revenue cycle work, and what does it tell us about where real progress is happening versus where expectations may still be misaligned?
Great. Well, it's great to be back here, Stuart, and exciting topic. I guess we have 11 months to deliver to some of the AI promise this year, right? So 1 month's already gone. But no, joking aside, I think AI in revenue cycle it's not a future discussion. It's here. It's embedded across front end and back end workflows. Um, And what has changed is not the technology from last couple of years when it was more about, oh my God, AI has this transformational ability to impact our workflows. It's how seriously it's being judged. The conversation is sort of moving away from capability and sort of shiny demos towards outcomes. We are encouraged by some of the early repeatable signs of progress that we're seeing in our business, right? As we've embedded AI across all of our solutions, we see productivity gains in front end rev cycle. We see more cash collections in the back end, and overall, just a trend towards cost to collect continuing to come down. And this is all against the backdrop of increasing complexity in RCM. Uh, so these may not be sort of transformational headlines, but they're meaningful operational signals we're starting to see. And our hope is through the course of this year, we really stop using AI as a term in there, and it just becomes the way we work. Um, I'm also seeing, I think, various articles that point to a sobering reality. I think Gartner research had suggested that only a small fraction of AI investments are delivering the transformational value, and only about a fifth deliver like measurable ROI. And I don't think I think those are great questions to ask and ponder over, but that doesn't mean AI doesn't work. It just means the expectations, process maturity, and us as leaders, how we bring in the discipline sometimes may be misaligned, and we have to sort of get that in order. The other thing I see is sort of frontline teams across the board. And I can speak for the revenue cycle space, but I'm guessing this is true across the board. Is there's a tool fatigue that every day, wherever you look around, there's something new coming AI. Old companies are reinventing themselves with AI. So there's just a general noise that's out in the market between in-house processes, vendors across the board, and navigating that is a challenge. But I think it's not a technology problem or understanding what technology is one better than the other. It's about leadership being able to assess what works best in their environment. So, like I was saying, I think my hope is as AI becomes more effective, we stop calling it out specifically and it just becomes part of our daily lives. It amplifies. And what I'm seeing is it has a tremendous potential to amplify and bring efficiency to clean business processes. However, when the business processes aren't well defined, they're broken, not built on strong fundamentals. AI will not deliver the results that perhaps many might expect it to. So there's definite hygiene and housekeeping organizations have to do within their RCM processes as they look to deploy AI. So, I mean, in a nutshell, I look at 2026 as shaping to be that sort of proving year, and we're super excited about it.
Yeah, that's awesome. Thanks for framing that. And you're right. I think one of the things that's technology is not going to solve everything. It still has to have those business processes because people are still seeing denials as top of mind. Prior authorization still leading the list in those denials. Payer behavior, the payer using, concerns that the payers are using AI to deny, claims faster and go after recoupments faster. And that's just a small, little subset of what's happening out there. There's so much more. So many of that we're gonna help us guide through this discussion today. So really appreciate you framing it in such a way. I do want to remind everyone, as always, we do have a Q&A. So we'll leave time at the end for Q&A. So please put your questions in the Q&A box here in Zoom. We'll get to as many as we possibly can as time allows, but also comments. Not just questions, but I also welcome comments. If you have any insights on the topic that we're going to be talking about today, please share those as well. We'd like to hear from you and your experience. So with that, JD, you ready to dive in?
Yeah, absolutely.
All right, all right. So when leaders ask why AI in revenue cycle management today, what problem are they really trying to solve, and where do you think that question is often misframed?
Yeah, so I think often I see a lot of organizations chasing AI for the sake of it being the new technology out there because organizations have formed AI committees, innovation funds, and things that, hey, we want to be at the forefront of it. But to me, it's a means to an end. What we have to look at is how do we stabilize outcomes in a more complex, low margin environment without burning out the humans that are within the system, right? So I look at it as if what's the, I guess, the way to frame it would be, what's the cognitive load the humans in the RCM process that they carry today that perhaps AI can address for them to make them better? I mean, you hear about AI making in the startup world, right? The 10x founder who can potentially start a business just as an individual person and scale the company. That's the same thing. Every individual playing a role within RCM, I believe that we can increase their output 2x, 3x, 5x by looking at what are the unnecessary tasks that they are carrying forward and how can we thoughtfully apply AI as we go about re-engineering some of these business processes. To me, it's the why AI is it's there, it's available, it's proven itself that it has the ability to transform. But we have to take it in bite-sized pieces and really look at the efficacy within each of our environments.
Right, right. It has to fit, and it has to fit our current workflows. Really, to your point, it just makes us better, makes us more efficient, makes us, you can use it the wrong way, like any tool. It's a tool that once it's used effectively, and I think the industry is just learning,
Yep.
what are some of those use cases that could be applied. So we're just kind of at I'd like to say the tip of the iceberg, pardon the cliche, but typically that's where we are. I mean, there's so many things that can be done. And being in the industry for 30 years and seeing change throughout that lifetime of my career, healthcare has typically moved really slow, but I've never seen it move as fast as it has moved,
Yeah,
at least just in the
that's a
last
great
year.
point.
So,
Absolutely. Yeah,
so
yeah, and I think there's a definite need and necessity around this, right? Like there's increasing complexity in RCM workflows, regulatory environment ever changing, reimbursement pressures, staffing constraints, increasing volumes, and just overall variability across the space that we're going to need a superpower, and I feel AI can be that
mm,
superpower.
awesome, awesome, yes. And you've actually mentioned and said, AI is becoming embedded into how revenue cycle works, embedded into the business processes. As that happens, how should leaders rethink accountability and expectations for AI outcomes?
Yeah, so I think first and foremost, as AI is getting embedded in the workflows, I think the accountability starts to shift from all of these models that we're discussing to really outcomes, right? Like at the end of the day, it's about, am I collecting more cash? Am I uh, reducing days to collection, reducing revenue leakage? So some of the outcomes we have to start measuring those. But I think as leaders, important in this early stage of adoption to allow AI to fail safely. So having a human in the loop approach where knowing that AI is not going to get there at 100% accuracy, efficiency. So having the ability to do that, monitoring the drift that can happen with AI, and having real leaders and champions within the organization that embrace this change management. It's difficult. It causes a lot of strife within culturally within an organization as you're adopting some of these solutions. So important to have champions within the team that understand the potential, that understand that this has the ability to actually transform, but live it day to day. So I feel as you adopt some of these to be part of your workflow, the leadership accountability actually increases. It doesn't sort of disappear. Um, it- AI has the ability to self-govern, but it has also the ability to drift pretty rapidly if
Sure.
not deployed with the right guardrails. So I think reiterating the concept of human in the loop is how I view it.
Yeah, and that is so critical with that governance for sure. So, and speaking of some of those outcomes, one is cost to collect, particularly when it comes to denials. And denials, as we were looking at those who registered for this particular office hour session, denials repeatedly came up as one of the pain points. We asked that question, what keeps you up at night? Denials, denials, denials. So from what you've seen, where do organizations misdiagnose the root causes of denials? And how does that limit when AI, can actually improve that?
Yeah, I think often what we've ended up doing is sort of accepting the fact that denials are par for the course, that they're going to happen irrespective of what we do, and we should just have army of people managing those denials and doing AR follow-ups sh- just to see through those claims and get them to collection. But just being so tactical, we've lost the ability to really be strategic and cognitive about what is it that's causing these denials and what are the outside factors that perhaps can be addressed, the root cause that we can then plug right once and for all to reduce the denial volume. I think just the sheer volume in AR that many teams face, they're not able to sort of step out of it and look at transformative approaches to fixing it.
Mm-hmm.
So I think having that ability, AI can give you that sort of ability, that increasing bandwidth to to, to start looking at some of these things. What are the root causes? Perhaps it's front end, perhaps it's in mid cycle, but whatever those are, and then applying more targeted fixes towards that, because the end goal should not be how we manage denials more efficiently. It should be how do we reduce denials altogether.
Exactly.
And I think AI has a lot of abilities to do that. Perhaps by not sitting in the denial workflow as much as denial workflows will help, it's also sitting in other aspects of revenue cycle and operational workflows within an organization to just run a clean claim that has low likelihood of getting denied.
Right, right. It's all about denial prevention, and how it can basically contribute to that. So,
Yeah, exactly. So, I mean, I know you're familiar with our more recent medical necessity tool, which can ingest payer guidelines and actually guide a clinician ahead of time on, is this a medically necessary procedure, and is there enough evidence to then be able to say that, yeah, this particular procedure is likely to get approved. So denial prediction also becomes an interesting aspect that AI can start to help out in.
Right. That's a game changer for sure. I mean, and other things come up like issues like incorrect insurance, missing medical records, eligibility and authorization gaps. These continue to surface. We just kind of see them over. It's like wash and repeat. But why do these front end breakdowns still create such outsized downstream impact across denials, collections, and time to pay? You may have alluded to this a little on this already, but just kind of elaborate a little further.
Yeah, so I think we have a unique position here at Infinix, right? In terms of the millions of eligibility and authorization transactions we process every year, and we have a window into the back end of RCM with looking at denials and where revenue leakage happens, and relatively consistently across all the organizations we help with our solutions, be it large health systems, hospitals, ambulatory facilities. The top denial reasons stayed relatively constant between
Yeah.
insurance eligibility, prior authorizations, a member not. I mean, those are the things that point to all of the front end stuff that perhaps could be done better. And again, here this is a classic example. If you've not captured a patient insurance correctly at the front end, AI is not going to be able to help much.
Right.
There is, you can do insurance discovery, you can do a little bit of stuff, but for the most part, if you didn't obtain an authorization and the procedure got denied, there's no retro auth likely to be happening, and that's again that revenue has leaked, and AI has no ability to go recover that for you. So it
Right.
goes back to sort of the point I was making earlier is fixing some of the business processes, getting the right solution sets, the team members to work together, and then apply AI to really supercharge those processes, right? So the leverage for AI is prioritization, early detection. It can start to do some of those things. So where it can then start to predict where front end breakdowns are likely to happen, what kind of impact they may have further down in the RCM process. But all of that's only possible if we lay the right foundation to deploy some of these things.
Mhm. Awesome. Awesome. Yeah. And so then, the next question kind of, leads from that where, many leaders really struggle with tracking unpaid claims, still not knowing what hasn't been paid. It's like this secret hidden uh, repository of claims that are just going unpaid and then managing time to pay. So how should AI in effect realistically support visibility and prioritization to all that without adding more operational burden or complexity?
Yeah, I think that's a great question, and something I feel we've reached a stage of almost death by dashboards, having visibility and slicing and dicing data for 100 different ways, but it says the same thing that there are certain key
Yeah.
problems that we got to go chase. So to me, it's isn't more dashboard, it's better prioritization.
Mm-hmm.
What are the claims that have a higher propensity to pay in the shortest amount of time using the least amount of human effort, right? That's going to drive cost to collect down. That's going to drive more cash in the system, and that comes through. That's fertile ground for AI to help out at, right? You've
Right.
got
Right.
historical data. You have the ability for AI to go out to pair and gather AR follow up information. So all of those things start to get automated, and you're able to see results. So very, very direct reduction in human effort, improved collections for sure. We've seen that in many of the places where we've deployed it, and really because previously the approach has always been, oh, let's throw more people at the problem, or let's only chase the high dollar claims because those are the ones where it makes sense for us to go chase. The other ones we don't have an ROI. Well, once you have AI embedded into your workflow, you want to go chase the one that has the highest likelihood of getting collected. That could be a low dollar value, but you just reduce your cost to collect that low dollar value, and it's worth going and chasing it. So
Mhm.
I feel unclaimed claims, AR follow up, uh, all of those things are extremely ripe for AI deployment, and we're seeing the results of it already. So we're very excited about it. Just the whole aspect of its ability to predict.
Yeah, that's awesome, and that's just a different way of thinking about it. It's really it is indeed more strategic, and I like your analogy, death by dashboards. I'm going to use that. So, well, also what I'm seeing as well is everyone wants efficiency with automation. It shows up very often in conversations that we have with clients, but they rarely define that clearly, or it's maybe other vendors or anyone who's offering automation and efficiency don't really clearly define it. Okay, what are you talking about? What do you want to automate? What's your end game? What's your goal? What's that outcome that you're looking for? So how should leaders think about efficiency gains in a more practical, measurable terms rather than just the sake of perfect automation?
Yeah, so I think we the way I would look at it is a lot of these are complex processes, and often they're long tail, right? So you have multiple pairs, uh, various nuances, plans within the pairs, a variety of different things happening. And when you go in saying, I want to automate my process, you're taking on a relatively complex challenge there. It and I've seen that success sort of builds up on those baby steps of proving out something that's working. So taking a complex business process within RCM, be it on the front end like authorizations, or if you want to look at denials and AR follow up, is breaking it down into specific tasks where, going back to my original point, where is the human cognitive load most spent, and can we reduce that? And it may be in the overall equation, you're not automating an end-to-end process, but you're starting to take away human effort in some key tasks that then opens up the human to be far more engaging towards solving the key problems that they have to solve. And over time, through that journey, you are going to see the efficiencies start to come in. Cycle times are going to go down. There's going to be less rework, less what I mean. AR industry is always talking about touches, how many touches on a claim. All of those things start to come down, but it starts with sort of decomposing the process into tasks, looking at which tasks can be automated, driving high level of automation into those individual processes, and then stitching them together over time to say, okay, now I have the semblance of an end-to-end automated process.
Mhm.
What we see very often is because decisions, people hear stories of AI's, what it can do and how it can transform, that they approach is that go solve it for me tomorrow, and it's a journey. I think
Right.
that's the one important thing that we've realized firsthand working with many of our customer partners is that it is a journey, and you need leaders on both sides to understand that and go for the small wins, because those add up pretty quickly, and before you know it, AI is embedded in your entire process.
Right. And I'm glad that you just described it as a journey, rather than a one-time implementation. So with that, how should leaders uh, evaluate partial but meaningful improvements? And what role should they play in shaping AI's use cases instead of reacting to vendor promises? Right.
Yeah. I think I would sort of center the evaluation criteria around, is it repeatable for a meaningful set of volume, wherever you're trying to deploy AI? Is it scalable, that it's not going to sort of break? And is it durable over time, that we know things change a lot every year? At the beginning of the year, payer guidelines change, CMS releases a whole bunch of stuff. So is it adapting to all of those things? We can say AI has the ability to do it. I agree there, but is it actually doing it within the use cases that we adopted in? So to me, it's defining use cases, perhaps initially narrow use cases, and then broadening them over time. not overcomplicating some of these things, right? Just saying that I want to go for the base, if this is just sports analogy, base hits versus the home run, just higher likelihood that I'm going to get those. And another sports analogy, taking more shots at the basket,
Right.
trying things. Right. I mean, if you don't try them, you don't know what's going to work, what's not going to work. So you definitely want to try more pilots, but have a short timeline on them and clear success metrics defined at the outset. That, hey, this is what I'm expecting out of it. And often, I mean, we tell some of our, when we're engaging with some of our prospects and customers that, on what's possible and what's not. And we love to engage with folks who are able to tell us what their success metrics look like, because sometimes if the business process is not there yet, you may not be able to deliver to that, and there's no reason for either party to set them up for failure around some of these things.
Right. Right.
So I think the ROI will show itself relatively quickly, but we have to look at it from a perspective that partial wins should not be considered failures. And I think that's probably a theme we should stay with for some of these early years as we're deploying these solutions, but then we should hold these same solutions accountable for outcomes.
Right. Exactly. Exactly. So yeah, point well taken. That's all the questions I have. We're now going to move to the Q&A portion. So just want to say again, if you have a question for JDeep or maybe even some comments, please share those in the Q&A. We'll get to them. I do have one here, JDeep, is states, many of us are trying to introduce AI into existing revenue cycle workflows without overwhelming already stretched teams. From your experience, what helps organizations successfully bring frontline staff along as AI becomes part of the day-to-day operations? Yeah, we hear that a lot, don't we? Yeah.
Yes. I think first at the outset, we're all humans and we hear a lot about how AI is coming for our jobs, right? And so it has a tendency to create a fair bit of fear. And I'm sure that fear gets amplified within frontline teams that are starting to see some of these messages around it, right? So I think um, the messaging of tying the benefits to reduced friction versus job elimination is something that's important. Talking about upskilling, reskilling, and just naturally saying that AI is actually going to benefit us, just like every transformational technology in the past has benefited us as just a whole. So I think that's important. I think human in the loop assistive use cases, again, very important. Um, from a deployment perspective, like I was mentioning earlier, change management champions, right? Folks that believe in the success of it, where it that we build on off of from there. That yes, we're going to deploy this. There's going to be some pain points initially, but we're going to work together to overcome them and get to a better state. Um, so I think those are some of the key things. So to me, it's sort of like the frontline trust is built when AI eventually makes the work easier, not just to say, oh, AI is smarter than the human and it
Mhm.
has the ability to do more. I think uh, in our business, in RCM, the tribal knowledge, the subject matter expertise, stuff that we've built over the years, it's not as easy for AI to replicate, and it's important as an assistance to AI.
Right, right, exactly. All right, so we have another question here, um, and I think you may have touched on this as I was reading the question as you were talking. But as AI becomes more embedded across revenue cycle functions, how should organizations think about governance and oversight to ensure accountability while still allowing teams to move quickly and learn?
I think this is going to continue to be an important aspect as we adopt AI based solutions. I think one of the key things I would say is just from a practical standpoint. Again, narrow use cases, deploy them, get a feel of what works, what doesn't work, and perhaps what we break in the process. So that's one aspect that excuse me, helps kind of defining the problem set, that how big of an issue is it or not. But for larger organizations, I think it's very important to have governance frameworks, just like they do for information security, patient records, and all those things. That this has to be part of it. It's just the mindset should be, we want to make this work versus not finding reasons why it won't work, right?
Mhm.
So good governance sort of speeds adoption by protecting that sort of credibility of what we're trying to do. But it shouldn't be to a level where it becomes a bureaucratic nightmare that you just can't get past. Because
Right.
already I know between the information security, cybersecurity is such utmost importance within healthcare realm. You have to rightfully go through a lot of checklists to make sure you're adhering to from a compliance standpoint. There's legal aspects. You have a fair bit of hoops to get past in order to deploy any solution. So this governance should be a little bit additive. It shouldn't just slow things down and bring them to a halt.
Exactly. Exactly. Well, I don't see any more questions. JD, thank you for coming on today and sharing all the conversations and insights that you got from those conversations and also personal experience. So it's always great to have you here.
Thank you. Great to be here, and look forward to the next time.
All right. And thank you to everyone else who joined us today and for sharing your questions. We still would like to hear from you. So if there's any questions you have beyond this, you can always reach out to us via our website. We have forms out there where you can ask questions and reach us. We do appreciate all the engagement that you had. You can also check out our website for additional articles, case studies, as well as solutions about everything JD talked about and then some today. Also, encourage you to listen to our Revenue Cycle Optimized podcast, where you can hear this particular episode again next week, as well as with other episodes that will be released next week as well. So thanks again for joining us, and we'll see you on the next office hours.
Great. Thank you.